Hi, Dr. Brian Bird here at Allied Physicians and Rehab. Dr. Julie and I see a lot of patients with foot pain and lower leg pain. So there are some things you can do at home to help out yourself and keep those problems once you get them improved, or even while you're working on them. Much quicker results, keep them at bay, keep your problems much less. Now, a big problem is inflammation in the body, which we will have discussed in previous videos. One of the videos you'll see with Dr. William Davis, one of our first videos, talking about the low grain or no grain approach, which would reduce inflammation. Highly recommend look into that. Looking at the pure structural components, well, from a standpoint of biomechanics or how the body works, we won't need to look at not just the foot and the ankle but up into the knee, into the hip, the spine, all the way up. So let's take a look at this picture right here, and we can see that a problem with the foot can be associated and throw off issues all the way up. It's all connected. So what we're going to start with today is we're just going to kind of focus in here and into the leg, but this is not all inclusive of handling foot issues. You still need to work all the way up. Hip flexor issues, for example, can throw your mechanics off from the hips all the way down. So let's start by focusing in through here today on this video. And we're going to minimize this one, and let me pull up a calf muscle picture. Okay, so here's your foot. We got the foot right here. So the different calf muscles, and this would be the front of the leg, the muscles that are in the front right here, okay, the muscles in the back right here and through here. All of these muscles need to be worked on because look at how they attach into the ankle, which then can affect issues like plantar fasciitis, where the plantar fascia is located. Let's go out of this and pull up a picture of the plantar fascia. So this nice little picture shows that there are 3 layers of plantar fascia, basically connective tissue that goes from where the toes are at, on the bone at the top of the foot, right before the toes meet, all the way back to the heel in deeper and deeper layers. Okay, so all these different layers need to be cleaned up and worked on as well. And if we go back to the prior screen, we can see, look at how these muscles are going to be affected. So it's all connected. So one of the things you can do, you go online and look up how to foam roll for plantar fascia. Here's a perfect example. The self-treatment for plantar fasciitis using the grid foam roller. So this 2-minute 47-second video shows foam rolling on these areas. Pretty nice. If you look over here, you can see here's somebody doing one of the things we're going to show you today, which is breaking up adhesions in this picture. We've got so many resources online now, which is nice. Different ways to help plantar fascia and foot pain. So looking at the anatomy again, going back to this calf muscle, or calf muscles, right? So this is kind of misleading. There's not one muscle, there's a bunch of them. But you work all these different areas. You could find a different picture and learn the anatomy if you want to further. But we go into this one, and let's look at the next step for breaking up the adhesions. So going over here, one of our massage therapists, Abby, is going to be our model. So she's going to put her foot right here. So reference some of those videos on how to foam roll in through your legs, which are nice. And then you could take something like a spoon. I've got a reflex hammer. Something that has kind of a blunt edge, not too sharp, and you can get in and work the plantar fascia. So you don't want to go up on the bone as much as you want to go right here, between here, and through here. So working these areas. You want to work all the way from the outside to the inside. You could also get somebody to work on it with a knuckle, working it out. As you loosen it up, you want to then extend the toes backwards and get in deeper, so you can get a further, deeper level in through here. You want to work this whole zone. You could also get up in between the bones on top. Okay, so let's get a video across here. So on this, we go here. We're going to go sockless for this part. We go here, right in between, get either some lotion or have sock on, and get in and break up adhesions in through here, and get in and free it up. You don't want to do it for too long. maybe 10-20 seconds, working it, breaking it loose. That's something you do throughout the day. Thank you. You could also use a golf ball. You put a golf ball underneath your foot, you roll back and forth. You could find something like some kind of hard edge, that would be, say, a piece of furniture that has something where you could put your foot across the top at home. There are foot massagers that have like shiatsu balls, things like that. Any of these things can help. There are ways to ice as well if you're really inflamed, but I find just getting it and freeing it up a little bit each day is really the best way to do it. All right, give it a shot.